I'd like to now go through the dental plans. What we'd like to remind everyone, because this is open enrollment, even if you recently chose your dental and vision plans, you can make a change during open enrollment to a different style if it's better for you or a member of the family. So if you go through the dental options, you'll notice that there's 2 plans with an identical $2,000 benefit. And your company, again, is incredibly generous. If you utilize the EPO dental network, it generally means that you have to stay within the EPO network, and you're going to have a lower cost out of pocket because the EPO dentists are less expensive than the PPO dentist. So for example, if you're going in for a crown or a root canal, and the cost with a PPO dentist for a root canal was, I don't know, $600, that same root canal may only be $500 under the EPO plan. For both of these plans, they look at what type of service you're getting done to determine how they're going to reimburse you. So I'm going to pull up the POS PPO summary just to go through that with you quickly as a review. And I apologize, they give us very lengthy documents. Okay. So when you're in the POS, or what we call the PPO plan, you're going to see 3 different levels of care. There's an EPO network component, a PPO component, and an out-of-network component. What they're trying to indicate to everyone here is you can basically go to any of the dental offices in any of their networks, or even to a dentist outside the network, and you're still going to have a full $2,000 per year benefit. The difference is if you go to someone outside the network, you're going to see they're only covering 80% of the cost, whereas in network under the PPO and under the EPO, they're covering that same preventative care at 100%. All right. Please do remember, and this is kind of our rule of thumb, if you're going to a dentist outside of the network and you're going to get more than $200 or $300 worth of care, or for a loved one, please ask your dental office for a treatment plan. With that treatment plan will come their estimate of what they think you're going to have to pay out of pocket. It's very important because we know that you have very good benefits through these plans, but dentistry is expensive. So you don't know if you're going to the dentist and you're just going for even a basic office cleaning, and Principal Financial believes that office cleaning should be $100, but your dental office wants to charge $250. What that means is even after Principal has made their payment to you or the dentist, however they reimburse, you're still going to have an additional cost out of pocket because your provider may give you a bill for more than the negotiated fee from the carrier.
Chuck, with this screen here, can you explain, because there's 2 columns that both say EPO. So which one is one of them supposed to be the PPO cost and the POS PPO cost?
No, so let me explain that. So I
okay.
apologize, it doesn't highlight it that well, but there's a thing here that says calendar year deductible. I don't know if you can see that clearly on the screen.
Yes, I can see that.
I apologize.
Mm-hmm.
What they're trying to indicate is if you go under the EPO or the in-network PPO, that you'll have no deductible for preventative care services. If you go to an out-of-network dentist, you would have a $50 a year deductible. So I should mention that the deductible under these plans is a one-time per year deductible of $50. It's not, it doesn't have to do with how many times a year you go. It's just a one-time deductible of $50. All right. And you'll see
so that column that says in network, that actually means in network PPO. That means the PPO plan.
It does.
Okay, got you. Okay.
And what they're trying to indicate here, although I don't think they did the best job in the world, is that if you get basic services and major, even with the EPO or PPO dentist, there is a $50 per year one-time deductible. All right. We do even have some orthodontia coverage on here for children. It is a maximum benefit of $1,000, but for any of you who have children going for orthodontia, we were able to get that from the carrier at a low enough cost for the temple to be able to take care of that for you. So it's something that you want to consider if you do need orthodontia for your child or children.
So much better in here.
All right. Any questions on that? No? Okay. So I want to go over quickly what is preventative care, what is basic care, what is major care. Preventative care are things like cleanings, x-rays, exams. For a typical cleanings, you get 2 per year. Full mouth x-rays once every 5 years, regular bite wing x-rays once per year. All right. Basic services would be things like a filling, oral surgery, a root canal, things like that. For all of that, you can see if you flip back to the prior page, basic services are covered at 80%. All right. So it means if you go in for a root canal and it's a $500 fee, they're going to cover 400 of it, pardon me, and you would pay $100 of that cost. Major services, they're covering at 50%. And when you go down here, things that are major are things like crowns, implants, bridge work, dentures, oral surgery that's complex, things like that. And in general, those are covered at 50-50. So what we're going to tell you to do is to be smart about how you plan this out, right? Because you do get only a $2,000 benefit per year. Yes, it's more than you used to get in the past, but it's still only $2,000. And to be frank with you, dentistry has gotten to be expensive. So we want you to get that treatment plan. Don't forget, whether you're going to the in-network or out-of-network dentist, we want you to know what you're going to be up against before you get all the work done. Every once in a while, unfortunately, we'll have a client who'll go to the dental office and they have some pain going on, whatever it may be, and the dentist does a lot of work and they don't have time to get that treatment plan, and they end up with a much bigger bill than they expected. The dental offices have gotten to be very smart about how they bill and how they're able to generate fees. So we're just asking everyone to be a good consumer and, again, be careful. All right. Any questions on the dental? Okay. So if you want to find a network dentist, this information is in your portal, but you go to principal.com/dentist. Or you can just call their 800 number and they'll tell you. All right, very straightforward and easy. It's on page 6 of your EPO book. Pardon me, POS book. All right, so I'll get out of here. Bear with me a moment. Okay. So I like the lower cost of the EPO because I kind of need a lot of dental work. It's a smaller network of dental providers, but it helps me to better control costs. So that's probably what I would do. I then would go ahead and look at my vision options. You guys have a terrific vision plan. It utilizes the VSP network, which is the largest private practice network in the US. Right? So if you call your neighborhood optometrist and ask them if they're VSP, typically most of them would say they are. Right? You see, I need that. I'm wearing glasses right now, so I'm going to go ahead and enroll. I'm going to open up the summary, though, to talk about it for a brief minute. As you'll see from the plan, pardon me, you have an exam copayment of $10. So that means once every year, if you want to go to your optometrist and get an exam, it'll be a $10 copay. That's in general worth $75, $100, depending, maybe even a little more, depending on who you go to. So a great option, $10 copay. And then if you need lenses and frames, as I do, it's a $25 copay. If you get single vision, bifocal, trifocal, lenticular, right, polycarbonate for kids up to the age of 18, it's going to be a single copay of $25, and they're going to cover the rest. All right.
Chuck, do you happen to know if places like Costco or Walmart, if they're covered under this VSP vision plan?
They are, because they're a discounter, they provide a little bit less of a frame allowance than you would get from a normal optometrist, but they're fully covered. All right. And then, of course, if you want contacts rather than frames and lenses, that's going to be covered. The wonderful thing about your plan in specific is that you get an exam every 12 months, you get lenses every 12 months, you get frames every 12 months. So you're kind of all covered. Any questions there at all? Okay. Again, if you need to find a VSP optometrist, they make it very simple. You can call their 800 number. They can help you find some VSP doctors, pardon me, or optometrists in your area, right? You will get an ID card on this. I know that in the past, for some of our clients, they actually don't get an actual ID card when they go direct with VSP, but Principal Financial will issue you an ID card. That's important for you to know. However, I will be frank with you in telling you, most optometrists don't need the ID cards anymore because most of them have gone electronic. So for most of them, you walk in, they ask you for your name, some of your demographic information, they punch you into the computer, and that's how they verify your benefit.
It looks like the with Principal, there's one ID card that's for vision and dental.
That's correct. So
Yeah.
for some people who don't enroll in the dental, they'll still get the vision ID card as well.
And vice versa. If you're
Of
not
course.
in vision, but you're in dental, yeah, it's the same card.
Right. Now, interesting, what you're going to see